Hi, I'm Dr. GVK Chaitanya Rao, your sinus doctor. Today I'm going to talk about the differences between the headache caused because of sinusitis and the headaches caused because of the migraine. As a sinus specialist, I see a number of patients coming to me with complaints of headache. The topmost causes for headache in these patients are 1. Sinusitis, 2. Migraine, 3. Tension headache. Today, let us try to differentiate between the headache caused by sinusitis and migraine. Before we understand what are the differences in the characteristics of the headache of sinusitis and migraine, let us try to understand the causes for the headache in sinusitis patients and the migraine patients. I've spoken extensively about the sinuses and sinusitis in my channel. You can click on the box above to understand about what is sinusitis. So coming to sinusitis, there are multiple sinuses in our head. There are sinuses above eyebrows, between the eyes, below the eyes, and the sinuses between the eyes extend all the way from the front of the head to the back of the head, just above the throat. There is production of a slimy fluid which is very thin in consistency called the mucus inside the sinuses 24/7. And this mucus needs to drain out of the sinuses to the back of the throat. When there is obstruction to the drainage pathways of these sinuses, then there is stasis of the secretions within the sinuses, and this mucus attracts the bacteria, and once the bacteria starts depositing within them, it turns into pus. This pus formation within the sinuses is what is called sinusitis, and this is what causes the headache in the patients having sinusitis. Coming to the migraine headaches, on exposure to certain triggering factors by the patients, which we'll talk about very soon, there is release of neuropeptides, the most important of which is the CGRP, calcitonin gene-related peptide. And once this neuropeptide releases in the brain, it causes increase in the blood vessel size within the brain, and this is what causes the headache in the patients having migraine. So now let us talk about the difference in the characteristics of the headache seen in patients having sinusitis and the patients having migraine. In the patients having sinusitis, the headache is felt in the region of the sinuses, that is above the eyes, behind the forehead, between the eyes, below the eyes, and sometimes can be felt on the top and the back of the head. This headache is more like heaviness, some kind of mild discomfort, nagging feeling. These patients feel when they bend their head down that the headache is also shifting. This kind of headache is present all throughout the day, every day. Sometimes they may feel that the headache is increasing when they have a cold or when they have allergies. Along with this headache, the sinusitis patients have some form of nose block, difficulty breathing through the nose, nasal congestion, postnasal discharge. Some patients experience reduced sense of smell or loss of sense of smell, and these are the common features we see in patients having sinusitis headaches. Coming to the migraine, in the migraine patients, the headache is triggered by certain triggering factors. The triggering factors can be having fatty food, cheese, drinking excessive coffee, red wine, excessive stress, lack of sleep, menstruation in women, and sometimes a simple thing as simple as having a head bath can trigger the migraine. So once the migraine starts, the patient can sense that they're going to have a migraine, they are going to have an aura. They may have flashes in the eyes, ringing sounds in the ear. These are not there for everyone, but some of the migraine headaches are preceded by aura or prodrome. And once the migraine headache starts, the patient will have a very severe, throbbing, unbearable headache on one side of the head and sometimes in the areas of sinuses also. And along with this headache, the patient has nausea, has some patients vomit, they are unable to see the light, they are unable to hear the sounds. It's very irritable for them, and they feel that they have to leave all their work, shut off the lights in their room and lie down, because once they continue with their work, the headache worsens. And this is a kind of headache we see in patients having migraine, which is very different from the headache seen in patients having sinusitis. So how do we as ENT doctors differentiate between the headaches caused by migraine and by sinusitis? See, we take a detailed history of the patient. we try to understand if the headache is associated with any other symptoms which I have mentioned in sinusitis patients and in migraine patients, and we try to find how frequent is the headache and how severe is the headache, and based on that we can come to some kind of basic idea about what the headache is caused by. Similarly, in some patients we advise nasal endoscopy or CT scan of nose and sinuses to see if there are any positive findings in the patient's scans or endoscopy. If there are positive findings, then it indicates it is sinusitis. And for some patients, we also advise medications for migraine on a trial basis for a few days to see how the patient is responding. If the patient has good relief with the medicines, then the migraine diagnosis is confirmed. So how do we treat the headaches in patients having sinusitis or migraine? Coming to sinusitis patients, we advise antibiotics, oral nasal decongestants, oral nasal antihistamines and steroid nasal sprays, and this gives some relief for the patients. If the relief for the patient is incomplete, or if the relief is complete but the symptoms are recurring few days after stopping the medicines, then we advise the patient to go for the endoscopic sinus surgery to open up the drainage pathways to help the sinuses clear up the mucus which is produced within them. Coming to migraine headaches, we look for how frequent the headaches are. If the patient is having less than one episode in a week, then we advise curative medicines like naproxen. If the patient is having more than one episode of headache in a week, then we advise preventive medication. The preventive medication can be flunarizines, tryptomers, amitriptyline, diltans, and sometimes also divalproic sodium. Now, I hope you have understood what is the difference between the headache in the patient having sinusitis and the headache in the patient having migraine. If you have any queries regarding this, you can mention in the comment section below. Thank you so much for your patient listening. See you soon. Namaste.